Welcome back, future lifesavers. In our last episode, we saw Zeke and Anya handle a potential heart attack call. Today, we're diving into the crucial topics of ethics, legal considerations, and patient rights in EMS. Let's tune in and see how our dynamic duo navigates these complex issues.
This is Captain Dave, coming at you live on First Responder Radio. We're about to get a masterclass in EMS ethics and legalities. This is the Flossing Your Teeth episode in which, if done wrong, you lose something and an incredible smell persists for years. Listen up, folks.
All right, Zeke, let's talk about some important concepts. What's informed consent in EMS?
That's when a patient understands and agrees to the treatment we're proposing. It's all about respecting the patient's right to make their own healthcare decisions.
Good. And what about implied consent?
That's assumed in emergency situations where a patient is unconscious or unable to communicate. We act in their best interest.
Excellent. Now, what's HIPAA and why is it important?
HIPAA stands for Health Insurance Portability and Accountability Act. Its main goal is to set standards for protecting patient information. It's like being a secret keeper for our patients.
Great analogy. Speaking of patient information, why is documentation so important in EMS?
Documentation ensures high standards of patient care and serves as legal documents. We need to include patient interactions, treatments provided, and observations made.
Perfect. Now, let's talk ethics. What are the 4 pillars of ethical standards in EMS?
Beneficence, non-maleficence, autonomy, and justice. In other words, do good, don't harm, respect patient choices, and be fair.
Well put. How do we ensure patient confidentiality?
We keep personal and medical information confidential, sharing it only with those directly involved in the patient's care. It's like Vegas. What happens in the ambulance stays in the ambulance.
Good one, Zeke. Now, what's the significance of do no harm?
It guides us to avoid causing any harm to our patients. Sometimes the best action is no action at all.
Absolutely. What should we do if a patient refuses treatment?
We respect the patient's decision, provided they're competent to make it. It's all about patient autonomy.
Correct. Now, why is continuous education important for EMTs?
To stay updated on regulations and best practices related to patient confidentiality and care, we've got to keep our skills sharp and our knowledge fresh.
Wow, folks. Zeke and Anya are really diving deep into the ethical and legal aspects of EMS. But wait, it looks like they're getting a call. Let's listen in.
Ambulance 26, respond to 789 Elm Street. 17-year-old female, possible drug overdose. Patient is conscious but disoriented.
You heard it, Zeke. Let's roll. What ethical and legal considerations should we keep in mind for this call?
Well, we're dealing with a minor, so consent might be tricky. We'll need to consider implied consent if she's not capable of making decisions. We also need to be extra careful about confidentiality, especially regarding potential substance use.
Good thinking. What else?
We need to remember our duty to act, provide care within our scope of practice, and document everything thoroughly. And of course, we need to treat her with respect and empathy, regardless of the circumstances.
Excellent. How do we balance beneficence and autonomy in this situation?
We'll do what's best for the patient while respecting her right to make decisions if she's capable. If she refuses treatment but we believe she's at risk, we might need to involve medical control or law enforcement.
Great point. And how do we handle the sensitive information we might gather?
We share it only with those directly involved in her care and document it securely. We need to be extra careful not to gossip or share unnecessary details with anyone, including law enforcement unless required by law.
Perfect, Zeke. You're really putting it all together. Remember, our role is to provide care, not to judge. Now, let's focus on patient care during transport. What's important to keep in mind?
We need to ensure the patient is securely fastened, stable, and continuously monitored. We should also try to keep her calm and reassured throughout the transport.
Excellent. And how can we use empathy in this situation?
By understanding and supporting her emotional and physical needs, we should speak to her calmly, explain what we're doing, and tried to make her feel safe and cared for.
Great. Now, let's say we arrive and find the patient's friends are there. How do we handle that in terms of confidentiality?
We'd need to be careful about what information we share. We should focus on getting necessary medical information from them, but avoid discussing the patient's condition or treatment in detail. We might also need to ask them to step away while we assess and treat the patient.
Good thinking. What about if the police arrive on scene?
We'd need to balance cooperation with law enforcement and our duty to protect patient confidentiality. We'd share only the information necessary for them to do their job, focusing on immediate safety concerns rather than medical details.
Excellent. Now, after this call, how would you ensure HIPAA compliance?
I make sure our documentation is thorough, but doesn't include any unnecessary personal details. I'd also be careful not to discuss the call with anyone who wasn't directly involved in patient care.
Perfect. Last question. How might this call impact you personally? And what should you do about that?
Dealing with a young overdose patient can be emotionally challenging. I'd make sure to take some time for self-care after the shift, and if I'm really struggling, I'd reach out to our department's mental health resources.
And there you have it, folks. Zeke and Anya turning a challenging call into a masterclass on ethics, legalities, and patient care in EMS. Remember, being an EMT isn't just about medical skills. It's about navigating complex ethical and legal situations while providing compassionate care.
It's clear that understanding the ethical and legal aspects of EMS is just as crucial as knowing medical procedures. EMTs like Zeke and Anya need to balance patient rights, confidentiality, and their duty to provide care, all while working within their scope of practice.
Great point. And it's impressive how they consider not just the immediate medical needs, but also the broader implications of their actions.
Indeed. To our listeners, remember, every call you respond to is not just a medical situation, but a human one, often with complex ethical and legal considerations. Always strive to provide the best care possible while respecting patient rights and adhering to legal and ethical standards. Now here's your homework. Review your local EMS protocols regarding patient rights and confidentiality. Practice scenarios involving ethical dilemmas, like patients refusing care or situations involving minors. And most importantly, reflect on how you can maintain empathy and professionalism in challenging situations.
Excellent advice, Don. And don't forget to stay up to date with your HIPAA training and other legal requirements.
Thanks, Dave. And thank you, future lifesavers, for tuning in. Next time, we'll explore more complex ethical scenarios in EMS. Until then, keep studying, stay compassionate, and remember, in EMS, ethical practice is just as important as medical expertise.